What are bone grafts? Do we need it after tooth extractions? And does it help secure dental implants? A bone graft is a surgical procedure that involves the transplantation of bone tissue. And we can get this transplant from our own bone, cadaver bone, animal bone, or synthetic bone. It is typically associated with dental implant placement, but it can also be used to help support a partial denture or a complete denture, or it can help support a deficient ridge if you're getting a dental bridge done. When we extract a tooth, the bone surrounding the tooth will shrink both vertically and horizontally. This can become a big problem, especially if you're considering getting dental implants in the future, because implants require a certain thickness and minimum height of bone in order for it to be stable and secure. But even if you don't want an implant, bone grafting still has some major benefits. For example, if you're getting a bridge rather than an implant, then we don't want to have too big of a gap between the pontic and the gums. And if there's too much bone loss at the extraction site, then the pontic has to be designed to be longer in order to close that gap. Well-fitted retentive dentures that don't move around require a good amount of bone, especially on your lower jaw. And bone grafting helps maintain the ridges after the extractions are done so that the dentures aren't too wobbly. So how does the bone grafting procedure work? Well, first you're gonna get numbed up and get that infected tooth removed. This will be done at a dentist or specialist office, and you're gonna decide whether to be sedated or not. Once the tooth is removed, the surgeon has to get the site ready for the bone graft. In the most basic terms, this involves using a bone file to remove any sharp points in the extraction socket and using saline to irrigate the extraction site well. And once the site is properly cleaned out of the infected tissue or granulation tissue, we can begin the bone grafting. Grafting material typically comes in a sealed vial, and we can mix it with the antibiotics before packing the graft into the extraction site. And after we're done, we want to secure the bone graft material so that it doesn't get accidentally removed when you go home. We do this by carefully placing a membrane over the graft and suturing over the site, which will prevent the bone graft from being exfoliated from the extraction site. Now, if you're getting an implant done later, then we typically want to wait around 3 to 6 months for osseointegration to develop within your natural bone. However, many surgeons prefer to do the extraction, bone graft, and implant at the same visit, which will save you guys an extra appointment. And finally, what is the cost of a bone graft? The cost of a dental bone graft will vary depending on the type of graft used and how large the grafting area is. To graft one extraction socket typically varies between $500 to $800 per tooth. But if you're grafting an area with a larger defect, it could be $1,000 or more depending on how extensive the surgery is. Of course, the best estimates are going to be done if you go to your local dentist or surgeon for a consultation so that they can get an idea of what type of surgery needs to be performed in order to have the best results for the implant or denture or bridge that you're going to be receiving. So this was a quick video about bone grafting. I hope it helps you and answer some of the questions that you may have about the procedure. If you have any comments, leave it down in the comment section below. And please, if you have the time, like, share, subscribe to our channel. We are going to be continuing to give you excellent dental content, and I'm going to be incorporating a microscope to do some live procedures, so I can't wait for that. Thank you for watching, and I'll see you for the next one.